Well, good evening, everybody. Welcome to our webinar about preparing for senior living, legal documents, Medicare, Medicaid, and also including a Medicare expert. Just a reminder, our next monthly session is going to be Thursday, November 2nd, enjoying the holidays while caring for your aging loved one. So just a reminder, we have these on the first Thursday of the month. We will be skipping December, but we will be having November 2nd, enjoying the holidays while caring for your loved ones. So we hope you'll join for that. I'm Paige Fairbanks-Gunn, the relationship manager for Koelsch Senior Communities of Arizona. I've been in senior housing since 1997 and have worked with over 4,000 families in my career. Koelsch Communities operates in 8 different states. We are family owned and operated since 1958. We offer independent living, assisted living, memory care. We also offer respite services and day stay services in all of our communities. All of our assisted living memory care communities have a licensed on-site nurse 24/7. Koelsch Communities offers exceptional care throughout, and we have so many resources, including one of our speakers today. So our guest speaker today is Pauline Hall. Pauline is a Medicare agent licensed in Arizona. She started her career 25 years ago as a paid caregiver while she was working on her human services degree. She then spent many years as a case manager for the Arizona long-term care system. Working with seniors has always been her passion, partly due to the amazing relationship she had with her grandmother. And then we have our national caregiving speaker and consultant. She provides a path to relieve the fear, anxiety, and overwhelm that family members experience when a loved one is diagnosed with dementia. She is the founder of Alzheimer's Family Consulting, a certified senior advisor, certified dementia practitioner, and is a certified in dementia care. She's also the author of the highly rated It's Not That Simple, helping families navigate the Alzheimer's journey, which is based on Pam's 14-year dementia and Alzheimer's caregiving journey with her parents. Please welcome Pam Ostrowski.
Hello, everyone, and thank you so much for spending time with us this afternoon. Just a reminder, this is a casual conversation. We're bringing up questions that we've heard from our own clients and sharing them with you, and we're sharing the answers with you. So this gives us an opportunity to help you be wiser, give you a chance to actually answer, or ask us questions. So be sure to use the chat. You click on the more button and you'll see chat at the top. Or it might be at the bottom of your screen. So be sure to add questions there, and then we will read your question and get you answers. So let's get started. This is a really big topic, so we're just going to scratch the surface and hopefully answer some of the more prominent questions that you might have. So the presentation or the conversation is about how do you prepare for potentially ending up in senior living in your later years. So, Paige, the first question is finances, right? So how do people prepare for senior living? What are some of the numbers? I get asked this question all the time as far as what do I need to be thinking about?
Absolutely. This is a huge question and very top of mind for many of our families that I work with and lots of people that I know. It's, oh my gosh, how much is this going to cost? So, evaluating your finances every year as you age is extremely important. Senior living communities range depending on the area you live in and also the quality. Independent living costs can be the national average of independent living starts at $3,000 and can go up to about $6,500 per month. Now, there are 2 differences with independent living. There's the life care buy-in type independent living, which is going to be on your higher end, and the life care communities. I know here in Arizona, they ask for it's a purchase in, so you're buying the life expectancy of living there, and those usually start at about $300,000 down. So you're buying into it. It's not a month-to-month rental. And then you have your regular independent livings that start at about $3,000, and that's just a month-to-month. And then there are also some low-income HUD type independent living communities, it's a financial, you have to be financially qualified, and those can start out as low as about $1,800 a month, but that's a financial qualification. So that's kind of the independent living piece. The assisted living national average cost is $4,700. Assisted living can go from $4,700 up to about $10,000 a month. Now, don't let that number scare you, but it also depends on, what level of care they need. Assisted livings really can care for you till the end of life. People don't have to be in nursing homes anymore. That's kind of a thing of the past. I started in a nursing home, and wow, things have changed over the last 25 years. So depending on the level of care and the level of services you want, they can increase up to about $10,000 a month. And also too, it's good to find out how many a la carte charges that some communities have versus maybe an all-inclusive type charge. And then you step into memory care, and the national average range for memory care, the national average for a memory care community is $6,900. Now that can go from $6,900 up to $12,000 per month. Again, I know this is a large range, but are they living in a small companion room with a roommate? Or are they living in a private room or a large private suite? Again, it can range kind of, pretty drastically as far as the difference in rates. There's also memory care. You have assisted living and memory care, but there's also a group home type setting that can care for assisted living residents and also dementia, and they can start as low as $4,500. But I will tell you, I would lean on the side that if someone has dementia, really shop if you're looking for a group home. Make sure they understand memory care and dementia. Make sure they understand all the different types of dementia.
Absolutely, 100%. And
absolutely.
that,
then,
are you okay? Go ahead. One more.
And then there's one other, there's a community fee. Everyone has a community fee. And a lot of people don't understand, like, why are these community fees? So the community fee, I kind of like to explain it to families as it's kind of your one-time HOA fee. It's your entry fee to get in. It gives back to the community to make sure they're keeping the community up to date for remodeling, to make sure that, the apartment and or the room is repainted and has new carpet or new flooring. So it's kind of like it's a non-refundable deposit, basically. And that's a one-time fee to get in. And usually people hope they put that down. It will hold the room until they move in, and then it becomes non-refundable. And those usually run anywhere from about $1,000 to $5,000. But I've seen in other areas in California and in Washington up to $15,000. So again, depends on, which kind of elite communities or very high-end properties you're looking at.
Right. And that totally makes sense. My experience with mom and dad, because they lived together, but had different plans, right? So that's the other financial aspect is if you're going to stay as a couple and move in, you're going to have different requirements. You're going to have different requirements for care. And to be honest with you, my parents did not have long-term care insurance. And we went through almost $400,000 in 8 years with both of their cares. And mom ended up, dad passed away after the first 4 years. And so mom's care and memory care was always significantly more expensive. So we kick this off. We're going to be talking about documents right now, but we kick this off with, hey guys, this is an important aspect of understanding the preparation. It's financial preparation. It's medical preparation. There's a lot of things that we want to make sure that you're at least aware of today. So what's our next question, Paige?
Okay, so Pam, what are the most important documents you need to have in place before moving into a senior living, and why?
So I love this question because my parents were big planners. And so by that, I mean, when I was 16, every other 16-year-old was going off and doing something fun with their friends. I was going to Hanscom Air Force Base or one of the military bases to learn about TRICARE for life. So my dad checked in every couple of years. He's like, do you know where everything's at? do you know where the will is? Do you know where the advance directives are? And I'm like, yeah, it's in the same place it always has been. So it was consistently drilled into my head, which I'm fortunate because I've had a will since I was 25. But let's talk about the differences between the documents and why they're so important. So you start out with your durable power of attorney, and that is a document that you can use when, or will use, when you cannot make decisions for yourself. It's typically mostly around the financial side of things, so bank accounts and that type of thing. And when you go to a bank, you can't just walk in and show your durable power of attorney. You should check with your bank and say, do you have your own version? I've had several of my clients think that they could just go in and show their version that their lawyer prepared, which is shocking. Their lawyer prepared, and the bank says that's not our version of it. So you need to go get fill out our version of it, which, they can be significantly large documents. So then they have to go and fill that out and then go back. So if you have an urgent financial need and that happens to you, that delays your ability to function or find a different way or source for that funding. So it is really important that you talk to all of your banks. Do you have your own version of a durable power of attorney for access to funds for this individual? And please, please, please do this right now. I mean, not right now, but this week, next week, and the next few weeks, because you don't know when someone's going to become incapacitated. And usually the banks especially want your person, the person that the durable power attorney is for, you want their signature. And if they can't sign for some reason, whether they're in the hospital or whether they've had progressed far enough in dementia where their signature isn't valid anymore, those are things that you just don't want to be in that situation. So then the next one is health, right? Medical or health, medical power of attorney. And that has more to do with someone speaking up for you. In other words, you are incapacitated and you need someone to understand what your wishes are in a medical situation. And that is closely tied to advanced directives. And that you might know that one of the types of advanced directive is the living will. And the living will is not a will like the other will. It is what your will is, how you want to live if you are in a crisis situation. So that includes everything from feeding tubes and DNRs, do not resuscitate, to how long you want to be kept alive with any sort of machinery or intubation. So it's all of these specific pieces of information regarding your health that is so important. And you don't want to put your family in the position where they don't know your wishes. So to me, the advanced directive is equally important as the healthcare power of attorney and the durable power of attorney. Finances, health in general, someone can make decisions while you're under anesthesia. And then if things go south and you need your loved ones to know what your wishes are. So that covers the big guys. The next one that you will hear about is a will and a trust. And a lot of people will say, well, I don't have anything to give away. Trust me on this. You have an estate attorney and you have an estate, whether you realize it or not. The people who will make a decision for you, if you do not have a trust or, more importantly, a will be complete strangers who are running, they work for the state and they function under the best purposes of the state. Now, I will provide a caveat there. They typically try to involve spouses and family members, but why would you put yourself in that situation where you're working with the state when you can appoint someone or a trusted lawyer, someone who could play that role? So the will is after you've passed, right? So disseminating your assets, whatever those might be. A trust is when, typically it's created for when you're alive and how you can manage your assets over time while you're alive. And if something happens to you, then there's a difference between revocable and irrevocable. It's big, right? So I am not even gonna go down that path, but you definitely need to talk to an estate attorney about that. And I personally, to add to that list of the documents that you need, is in case of dementia, and in case of dementia plan. That's what I create with my clients is, okay, what are the things that we need to look at from a diagnosis perspective? What do we need to look at for trigger points? And how do we react to the trigger points? And who do we involve? And who's on your care team? And all that stuff. Because 1 out of 9 people 65 and over have been diagnosed with Alzheimer's. So there's a risk there. So why not plan for it? And then lastly, I don't know how many of you folks are from Arizona. Just click in the chat, me, if you can. But in Arizona, for if your loved one or you end up in a behavioral hospital, in other words, things have kind of, your brain hurts, things aren't functioning quite properly, and you could be having heart issues or brain issues, and they basically take you to a behavioral health facility and take you off your medications and kind of titrate them and adjust them to make sure that you're feeling all right and you're behaving like you normally do. However, in the state of Arizona, you must have a mental health power of attorney, because if you don't, and you only have the healthcare power of attorney, you will not be allowed to make decisions. You are not the first decision maker for your loved one. And that's kind of a big deal. Here's the other catch to that. And this is taking a long time, I apologize. But the other catch to that is, with the mental health power of attorney, the person who's going to be getting that behavioral care has to be cognizant enough to sign the document. I have a sad story where someone, one of my clients, we had some issues with a husband, and it moved him to here to Arizona, and she didn't have the document. And the lawyer said he has to sign it. So now it's the facility that gets to make the decision on when he departs and where he goes and whether they release him and when they release him. So kind of a pretty disturbing outcome if you don't have that right paperwork. And other states might have, like in other states, it's called a psychiatric health power of attorney. So check that out in your state. So this takes us to the DNR. And Paige, I know that you have some comments about DNRs. So can you fill us in on your perspective on that?
Yeah, absolutely. So I think some of the confusion with DNR, families will come in and they think, oh, well, I have a do not resuscitate that is located in my living will. And it may indicate that there is a do not resuscitate in there, but in the state of Arizona and in other states in our company, require an actual additional form that is a do not resuscitate, or what they call a POST in some other states. Yep. It basically indicates you do not want chest compressions. So some people may have a living will, which indicates maybe you don't want a ventilator, or you would not like to be placed on, you don't want to be intubated, but you would like chest compression. It kind of is
like after the like in the hospital.
Yes, exactly. Yeah. Yes. And so that's one of those forms that I have to clarify that for families when they come in. So
yeah, yep, totally makes sense. So
sorry to interrupt.
Oh, no, not at all. No.
I was like, when you're saying that, it's like so true, because it's like I would, as a case manager going in folks' homes, even that DNR was so important, because it have to be on that orange form, and it have to be on that refrigerator. Otherwise, if 911 is called and they're there, they're going to give that person chest compression.
That's right.
Work on them right there.
If they don't have that orange form, that's right. We're going to do everything to keep them alive until the paramedics and first responders come. Yep.
You'll do the same thing. Yep.
So this brings up an interesting topic, Paige. One of our clients said, which of these documents do you see most people do not have when they move in?
I would say do not have, it's becoming more and more common that they are having them, but I will get people that come in and do not have the mental health care power of attorney. And what that, that can cause issues, because what happens is if they don't have the mental health care power of attorney in Arizona, and like you said, there's other states that have this, this requirement as well. With dementia, like you said, if they're having any sort of maybe severe behaviors, there's something going on that the community is not able to handle their behaviors and they've got to send them to a geri psych hospital. If they don't have that mental health care power of attorney form that's in addition to their regular health care power of attorney, you have to basically get an emergency temporary guardianship to get them placed into a geri psych
That's
hospital.
not easy.
No, and that's
Or
very
cheap.
complicated. No, and it can cause lots of money and it becomes very complicated. And it's just not, it's not good on the resident, because all these things are kind of backed up in a pipeline. We're trying to get all this stuff done when all you needed was the form.
Yep.
So, again, it's kind of, having all your ducks in a row and having that big book ready to go like Pam's parents had for her.
Yes, quite the binder.
Yes.
So Paige, how does, and I'm going to ask you specifically about Koelsch,
Yes.
but I imagine not everybody does this, but if my loved one falls or something happened, they have a heart attack, or there's a suspicious behavior of, clutching a head or a heart or whatever, what do you do? Like, how do all these documents play as far as, do you provide anything to the
Yes.
ER folks, or how does that work?
Absolutely. So all of our Koelsch communities, assisted living and memory care. Now, mind you, independent living is independent living. They hold their own, they're on their own. But as far as the assisted living umbrella and memory care, all of our properties have a nurse on site 24 hours a day, and we provide a hospital ready packet ready to go with all of the advanced directives, including their healthcare power of attorney, their mental health care power of attorney, their living will, DNR, if applicable, including their insurance cards, and also a copy of their history and physical, their most recent, and also their medication administration record, which is called a MAR. So it gives a list of all the medications with their allergies and so forth. So we have a packet ready to go, boom, to hand to the first responders and or paramedics, when they come on site to the community. And I will tell you, not all communities provide those. I've been in communities before where so the paramedics rush in and the care staff and the caregivers and med techs are running around. Oh my gosh, I got to get the chart. Now I got to make copies of all this stuff, and they're running around and it's like, no, have it ready to go. We have it in the back of their chart. It's in a manila envelope, packed envelope, ready to go. Here's the hospital packet.
And I think that's also interesting because, Dad was actually in hospice and his they had a packet for him as well. So the moral of that whole story is, guys, make sure that if you're moving into senior living or you have someone who's in memory care or assisted living already, so who would they contact to find out whether the community that they're in has a packet, or whether they need to provide a packet and give that to the community? So what person would be the nurse? They
would need to contact the executive director.
Okay.
First the executive director, and then they would need to contact if they have a nursing director. Most assisted livings do have a nursing director for the most part. Some have what they call a care coordinator. So whoever's in charge of the care piece. Okay. And so for instance, with ours, it's the director of resident services, which is our nursing director. But so you can always start with the executive director.
Yeah, and I'm a firm believer that's where you start, no matter what your question is.
Always start at the top. Yep.
Right.
Yeah. Stephanie's like, okay, Pam, have a seat.
Right.
Here we go again. So speaking of memory care, is there anything, because like with my mom, she couldn't speak, and many of her peers in memory care wouldn't have been able to articulate what they needed, or even if they're in pain. So are there documents that are specific? Well, maybe not specific is the right word, but are there documents that you make sure you check in with the family and say, okay, we need X, Y, and Z if this loved one's checking into or moving into memory care?
Yes. What we require a healthcare power of attorney, including a mental health care power of attorney. Now, they don't necessarily have to have a living will. Some people, you'd be surprised.
Yeah.
But most of the time they have a healthcare power of attorney. But if they don't have a living will, what we do need to know is do they want to not be a do not resuscitate? And if they want to be a DNR, the power of attorney has to sign the DNR form because they're making decisions for them. And then the physician has to sign off on, the primary care has to sign off on that form. If they do not have a DNR, we consider them a full code. And what a full code means is we're going to do everything to keep them alive. And in our circumstances, that means chest compressions. So we're going to do everything we can to keep them going until the first responders get there. And then they go to the hospital, and the hospital kind of takes it from there. So we do need to know.
Yeah. And just as an aside, because I lived this, and mom had to go to the hospital and she would not have wanted to go. And we didn't have the paperwork in place. But the next time something happened, because she couldn't speak for herself, right? So we had to backtrack to 8 years before we knew that she couldn't speak, to make sure that we had her wishes documented and had the DNR. So your loved one, and this goes for everybody on this call, for yourselves, for your loved ones, for your children, for your grandparents, whatever age you're at, advocate as much as you can to everyone you meet, grocery store line. Hey, do you have a living will, and do you have your DNR in place? I'm only half kidding. But it's so important.
They are easy to find. They're easy to find. They're easy to get. They're easy to do.
You go on to the Attorney General's you get onto the Attorney General website on any state and go under Advanced Directives, and you can find these forms. Now, we're talking healthcare only. When it gets into finances, that's an attorney and that's separate. But healthcare stuff, they're all on your Attorney General's website.
Yep. And so when we talk about healthcare, this is a very personal decision. So it's really important that you have it documented, so you don't have family dynamics can get really weird when somebody gets sick, and you'll have people arguing, and you may want them to let you go, but your daughter doesn't want to, and we're going to keep them alive as long as we can. That's not good. So we want to document everything you possibly can.
Yeah. So, and even some circumstances too, I've had families come in and they're deciding, do we put mom on a DNR? She told me she wanted one. Well, I don't know. We got to keep her going. And I say, okay, you guys kind of sidebar, you go have a family discussion. In the meantime, while mom is moved in and she's here, she's considered a full code, and we're doing everything we can until you can provide that document to us. So, and
that's going to be hard because she can't sign it anymore because she's in Medicare.
Absolutely.
She cannot recognize that what that document means or what it says.
That's
so
right.
that's when it's too late.
That's why you got to choose it. You got to choose it can get very sticky.
All right.
So we're going to down and choose a person you trust to make that decision.
Yes.
Exactly. And preferably someone younger than you. But you never know. So we're going to shift gears now. We've talked about the durable power of attorney, healthcare power of attorney, trusts and wills, living will or an advanced directive, as well as a dementia plan and the Arizona mental health power of attorney. And now we're going to move to our favorite, Medicare and Medicaid. And this is where Pauline is going to shine, and I'm going to shut up. I'll just be asking questions. So first I'm going to ask Paige, though, because this topic is really around, hey, I'm thinking about moving into senior living, or if I decide to move into senior living in 3 years, what do I need to know before I do that? So Paige, what do Medicare and Medicaid, there's two different things here, guys, cover when it comes to senior living? And that, do they cover anything in independent living or assisted or memory care? So help us out with that. How does that work, or does it work? What's covered?
That's a great question. I do get, I still get quite a few questions about this, and I'm continually always trying to educate my friends about their parents, and kind of like telling everyone at the grocery store. Medicare pays for absolutely no room and board in a senior living community, period. They do not pay for independent living, assisted living, or memory care support. Medicaid, and Pauline can kind of, she'll dive more into the Medicare part, but the Medicaid piece, now Medicare is your Medicare, your kind of your hospitalization and your therapy portion of things, and and prescriptions. Medicaid is if somebody has run out of funds and they need to go on state assistance. So Medicaid, which in Arizona is called the Arizona Long-Term Care System, that can be paid for in Arizona in an assisted living community. However, they have to be certified for it and they have to qualify for it. In our communities, in Koelsch Communities in Arizona, we do have 2 properties that will allow a resident to private pay and spend down after 3 years, and they can apply for that Medicaid if they are still with us. And so, and once you're on Medicaid, it does not pay for a private room. It pays for a companion setting.
Good point. Good point. So, Paige, we have a question that we get quite frequently. Can you ask Pauline this question?
Yeah, let's get.
Yes. So I can go. Yep, you got it.
Yep. So does Medicare cover any senior living costs, Pauline, such as assisted living, medications, durable medical devices, or caregivers?
Okay, so yeah, so that's where you talked a little bit about the room and board, so that was perfect.
Yep.
Because Medicare will not pay for that room and board. And I want to just touch real quick on the Medicare versus Medicaid. So the Medicare, in case folks don't know, is the federal program. So that's the Medicare is the federal program for people who are 65 and older and retire. We're all paying into Medicare, or some people are actually under 65. If you're on Social Security disability for 2 years, then you're eligible for Medicare as well. And Medicare is our insurance piece for our medical conditions. So as I say that. Now, Medicaid is a state-funded program for people who can't afford insurance, usually, or they might have a disability and didn't work enough to have Medicare, or the Medicaid piece also, when people need long-term care, there's a Medicaid state piece that pays for the long-term care. So that's just like a quick overview. Hopefully that wasn't too confusing. But their Medicaid is run by the state, and the Medicare is the federal program. So with the Medicare federal program, the long-term care piece that's available is only for a skilled need. So everything under Medicare is for a skilled need. It's for something where it's medically necessary, not long-term care necessary. So if somebody needed to go to a skilled nursing home after a surgery, Medicare will help pay for that skilled short term, get you back, get your rehab going, and then you're going. But as far as assisted living, as far as independent living, as far as caregiving, the caregiving would only be covered for that short term, maybe in the home after a surgery by a nurse. So everything's skilled based. So when they see somebody who's like, oh, well, my mom had a caregiver for a few weeks, or had a nurse for a few weeks, and that was that skilled piece after a surgery or something like that. But when we also pay for medications, also paying for medical equipment is considered a medical need. So wheelchairs, walkers, no bathroom safety equipment, unfortunately.
What
That's
about
been
physical
interesting.
therapy?
Physical therapy, yes. So physical therapy, whether it's in a skilled nursing facility for rehab, or if it's outpatient, or even if it's in the home, there's some physical therapy that can go in the home. Short-term skilled needs. That's kind of the key point when it comes to the Medicare piece. And even whether you have an Advantage plan, Part C, or if you have the supplement plan to go with your Medicare piece, you're going to have a rider for your long-term care. You'll have to do something else for your long-term care needs. And that's the 2 different things when they talk about skilled or they talk about long-term care. Those are the 2 main things to discuss there. There is no long-term care coverage on there with Medicare.
Yeah, my dad was really upset when he wanted to keep his TRICARE for life, but he couldn't drive anymore. and TRICARE always pays for medications and then have Medicare as the backup. So it's important when you're looking at the different offerings, right? Because and I want to get to the question of the introduction talked about who Pauline is and what her background is, but this is also having a Medicare agent in your life is a lifesaver. It is a life raft because these individuals locally, right? So don't call the 800 number. So
oh yes, please don't call the 1-800 numbers.
So Pauline, tell us a bit about what a Medicare agent is. Tell us a little bit about what a Medicare agent is, and then how do people here find either calling you if you're in Arizona, because that's a territory, or how do they Google, what terms could they Google, or can they email you to ask, hey, how do I find a person just like you in my state?
Yeah, well, good. That's a great question. So I did put my information in the chat, so feel free to email me if anyone has questions. My email's in there. And basically, being a Medicare agent, I don't work for Medicare. We don't work directly for Medicare. We're all independent agents, or like myself, I'm a captive agent. So I work for a particular health company, but we do have license. And so we have a license in this state. Some people can have a license in different states if they've lived there before and know what's going on in that state, and then they can move to another state. So somebody might live in one state but have a license in 2 different states. But there's a lot of local agents right there, real people bodies around. In Arizona, we're on every corner. And there's some of us who have a lot more experience than others. So there's some like myself who, like, I was a caregiver. I started that way. Then I was a case manager. So I've been working with insurance and looking at folks' insurance for a very long time. So I think it's very important to find someone who understands not just Medicare and the insurance world, but understands the personal needs of folks, because that's the most important piece of it. Is everyone's going to have a different need, and needs change throughout the years. So someone might need this plan now, or if they're going to move into a community, they might need a different plan, because that's also something that I wanted to bring up. If you're moving from state to state, you might have to really look at your insurance to see if you have the right insurance for that state. I think I'm getting a little away from the topic, but sorry.
We'll pull you back in.
Bring that one back. Reel me back in on that. But when it comes to Googling too, I just want to kind of bring that. If you're putting in Medicare broker, a lot of times you can Google Medicare broker, you can Google something like that, and it will have the reviews, and you can see if they're in town, if they have a local office, and you can give them a call. And a lot of them will meet you in person, or you can go to their office, and that's a good way to do it.
Yeah, and in that way you can ask your questions. You're doing the eyeball to eyeball. The thing Pauline and I were talking about before the webinar started is that calling the 800 number, you're going to talk to somebody who's a broker, but they're not going to necessarily just let you go. And once you submit your phone number, then you could get a lot of phone calls from various people. So if you do the local broker, that way you stand a much better chance of having a personal conversation and avoiding a lot of the do not call situations that we run into when we give our number to an 800 number. So just a heads up, guys, we're trying to protect you. So I think Paige has a question for you, Pauline.
Yeah, so Pauline, and this is a great question, and I learned, I'm going to be learning from you on this one, because these are great questions to talk to families about, especially when they're moving in. How important is it to talk to the community management regarding which mobile doctor they use or which long-term care providers they have?
Oh, okay. So that's a great question. Yes. And I've got this a lot because of my long-term care experience. So when you are moving into a community, there's like kind of the twofold. There is mobile doctors a lot of times who go into these communities. And so who's going to be paying for that? Your Medicare provider. So your Medicare provider is going to be paying that doctor who's doing that mobile visit to see you or your loved one. So you really just want to make sure that they are contracted. So they're contracted with that Medicare plan. So finding out if that Medicare plan matches that community and matches who those doctors are in that community, that they can bill that provider. I've seen some communities where they even had like an on-site physical therapy, and they've had other specialists like in the community. So you might not be able to use that if you don't have the correct insurance that's contracted with that
Wow.
physical therapy or that doctor's office. Yeah.
Well,
That's
that's
good.
interesting.
Kind of like making sure that you've got someone, making sure that wherever you're choosing to go, that your insurance is in network with them.
For those other pieces, because
Yeah.
of course they're not going to be paying for the room and board, they're not going to pay for the community, but what else is available in that community that insurance does pay for?
Or could, but not necessarily. So
Yeah.
the takeaway here is that if you're thinking about moving into a community, ask these questions before you hand over that community fee that Paige mentioned earlier, right? And say, okay, so I have Medicare, and I don't have the terminology right, but I'm on Medicare. Who's your doctor? Who's your PT, physical therapist? Who's your occupational therapist? You know, whatever that list might be for things that would be normally could be covered by insurance. Because if they're not, then you either need to, correct me if I'm wrong here, Pauline, change your Medicare plan or don't go to that community. Those are kind of your options, right?
Yeah. Perfect. Because
Okay.
and there is times where you can only change your Medicare at certain times of the year.
Right.
So we got to look at that too. And one of them, when you're moving into a community, especially from state to state, that would be if you're moving from California to Arizona and you're on a plan that's in California but's not accepted in Arizona, you're want to make sure that you get that switched over before you even move.
Yep.
And that gives you a special election period to change your Medicare.
Yeah, so my dog agrees with you. So tell us a bit more about that. What's the impact? So let's say, well, let's use your example. I'm in California. I've already signed up for Medicare. We need to talk about ages and when you sign up and that kind of thing too. But I'm moving from California. I move into Arizona. Been here a few months, didn't change my plan because, it's a federal plan, right? So people are going to assume that they're covered anywhere in the country. So the next thing is something happens and I need to, show my Medicare card. What happens next if I haven't transferred over to Arizona as the example?
Okay. So there is like kind of twofold when it comes to that, because if there's where you have Medicare primary. So if someone has Medicare primary and then they have a supplement or a Medigap plan, that usually won't matter. There usually won't be problems with that, except for their drug plan. Your drug plan, you need to figure out your drug plan and make sure that you change that over to the new state that you're in. So whenever you move out of a service area, you want to call and get that switched. Now, if you're on a Advantage plan, so that's where that Advantage plan, that private company, is your insurance. And a lot of people get that confused. If you're on United Healthcare, Cigna, Humana, Devoted, if you're on that, that's your primary insurance. You don't have Medicare primary anymore. So if you're in California and you're on their Advantage plan and you're in a certain area, and I just had this happen. This is why I always bring this one up. It happens quite a bit. And she moved to Arizona to be with her family, but her family didn't even think about checking her Medicare. And nobody checked her Medicare. And so she was here and she was trying to set up a doctor's appointment and they didn't accept her insurance. So with Medicare rules, when you're changing over your Advantage plan, they'll do it the first of the next month. So when she called me, it was the 5th. So we couldn't change her Advantage plan over until the 1st of the next month, which means she didn't get a doctor's appointment until the first, till after the next month, unless you wanted to private pay for it, or go back to California.
Yeah.
And that's what,
right.
yeah, go back to California and see your doctor and come back. So That's what's really, really important before somebody moves in somewhere, to look at their insurance and see what's going to be affected. Because the community, I mean, it was independent living. So that's another piece. It was an independent living community. They're not assisted. If it's assisted, a lot of times they go a step further and look at those things.
Yeah.
But if it's independent living, that's like moving to an apartment complex. They're not usually going to ask you what your Medicare is. So that's like really something, and it's our responsibility to kind of look at that. And what I tell people, and what I've done before, is that if you know you're going to move at the beginning of the month, if she would have called me before she left, I would have had it start for the 1st of that month. I would have had it start for October 1st, because she was moving on the 5th. So she would have had her insurance while she was here. So,
okay.
And being an agent in Arizona, I could have done it over the phone with her.
Yeah.
Yeah.
I think we have one more question.
That's really important. That's where I just wanted to chime in. That's really important, Pauline. Like you said, because our assisted living, and I think most, I don't like to say I assume, because we know how that can go sometimes, but in our communities, I know that our directors of community relations and our teams really do look at in assisted living and in memory care, look at, okay, most of our mobile physicians that come in, we're in a very senior housing market. I mean, Arizona, California, Florida, different. But if you're in a smaller state, not everybody's going to have, mobile physicians that are going to be able to, have physicians that are going to be able to take all the insurances like we do in Arizona. I mean, like all of our mobile physicians have, a huge blanket they take just about everything under the sun, which is great.
Yes.
But independent living, I'm glad you said that. That is key for those of you that maybe have a parent or a loved one, or maybe you are looking at moving into independent living. That's a very, very good thing to look into, because we do have mobile physicians that come into independent living as well, but we don't look at those things. We're not necessarily, unless they ask us, we don't, they're independent. This is, they're guiding their own healthcare.
Right. Right.
So.
And that's why I just wanted to make one more point with knowing an agent in that area, finding a local agent who's been there, who's knows what's going on. And even sometimes asking the communities, do you guys work with a Medicare agent? Because sometimes if you have a referral to that person, I know who the doctors are who accepts those plans. Like, I know what questions to ask. I know somebody's who's moving in. So I know the doctors who are around. I know what's available around. So calling a 1-800 number to change your Medicare might not always be that helpful, because they're not here. They're not boots on the ground.
Right. Exactly. Yes. So we've got another question for you, Pauline. What are your Medicare options, and what is the difference between your traditional Medicare versus Medicare Advantage?
Okay. Yeah. So we could have a whole segment just on that, but maybe
the Reader's Digest, right?
Let's get the Reader's Digest. So yeah. So basically, there's they say like 2 ways to have your Medicare. You have your Medicare price. So Medicare all by itself only covers 80%. And that's what a lot of people don't know. They don't know Medicare is an 80-20 plan. Medicare covers 80%. You're on the hook for the 20. Unless you got TRICARE for life, Pam. TRICARE for life will pay that 20%. So you can have your Medicare primary as your Medicare primary insurance. And then you can get a Medigap plan or a Medicare supplement plan that will have a premium every single month. And you pay every single month, and then there will be less to pay when you go to the doctor. But then you have the Medicare Advantage side, where basically your Medicare Advantage or Medicare, I don't like to say replacement, but that's kind of what it is, where that Medicare private companies take over your Medicare. Most of them have a 0 premium. So you're going to pay 0 per month for that Medicare Advantage plan on top of your regular Medicare. And they become primary over your Medicare. But you'll still have that Part B premium. So Part B, there's A doesn't really have a premium usually. B has a premium. But again, it only covers 20%. So you get a premium to cover your 20%, get another premium, get your drug plan separate. So there's your A, your B, your drug plan, your supplement plan. or Advantage Plan Part C. Advantage Plan Part C usually has a drug plan included in it, but it takes over. It's getting paid monthly by Medicare. So Medicare's paying that Advantage Plan, paying that private company to help you with your Medicare.
Wow, my brain hurts.
I'm
You were
so
talking.
sorry. I don't know a good way to explain this without having a chart up.
But I
show
loved
people.
what you said yesterday about your parents. There is a financial, I mean, like,
Yes.
talk about that. What you said yesterday
So
with your
my
parents. I
like,
thought that
that's
was
the thing
great.
with my parents. Like, everybody's different. And that's what I love to say. Like, everyone is different. And that's why it's good to have somebody to talk to who does a needs analysis for you. Because for somebody to say, like, oh, you should never get an Advantage Plan, or oh, you should only get a supplement plan, or only get an Advantage Plan, it really depends on what's right for you. 50% of Americans who have Medicare, 50% of Medicare eligibles are on Advantage. The other 50 are not. So it depends on what you need. My parents, I have them on an Advantage Plan. When they turned 70, once he retired and was eligible for it, I have my parents on an Advantage Plan. They don't have a lot going on. They're going to save that premium every single month. They want dental, they want over the counter, they want these benefits they're going to use every day. They live in Florence. They're not going anywhere. This is where they live. So we take that $1,500 premium and we're putting that into different types of savings, different types of investments. If they go to the hospital, yeah, they'll pay a copay when they go to the hospital. They know that. But right now, them being so young, they're going to take that savings for that premium that they're going to have and they're going to put it to something else in case their car breaks down, in case their AC breaks down, in case they go to the hospital. So everybody's different. But then you got some people who can afford it and they've got money that they can afford it and they do the supplements. And sometimes it depends on where you live. Arizona, we have so many great Advantage Plans to choose from because we have a lot of people who are eligible. If you're in a smaller place, there might not be as many eligibles in that place, so you're not going to have as good Advantage Plans in that area.
You mentioned age. Can you speak to that a little bit? So just to make sure everybody's on the same page, when can I sign up for Medicare? And then, what other questions around age do we need to be paying attention to? Like, when can we change our plan? How does that work?
Okay, so yeah, there's special enroll. There's special times where you can enroll for Medicare. So specifically, the normal is when you turn 65 years old. That's when you're eligible for your Medicare benefits if you've worked at least 10 quarters or your spouse has worked at least 10 quarters. 40 quarters, 10 years. So you have to have worked in order and paid into Medicare to be eligible for it. Once you're 65, you have 3 months before the month of your birthday to sign up for Medicare to start the month you turn 65. So you're really signing up for your Part B benefits. Your Part B benefits are the doctor's benefits and the outpatient stuff. Your A, most of the time you're not going to have a premium for that unless you haven't worked. So Part A is the hospital, skilled nursing, rehab, hospice. Part B is the doctor's offices, x-rays, labs, things like that. So that's what you're signing up for, is that Part B. If you're still working, some people are still working and they have great benefits through their employer, they can defer that Part B because Part B costs $164 a month. So when people turn 65, that's what they're kind of looking at. Do you need to take your Medicare? Because if you don't take your Medicare when you're 65 and you don't have other employer coverage or credible coverage, you're going to have a penalty to sign up for it later. So you really want to look at those benefits and the drug plan.
That's what I was curious about, was when that penalty
the drug
hit.
plan. Even if you're not taking medications, if you don't sign up for a drug plan when you're eligible, you will have a late enrollment penalty later that lasts for the rest of your life. And it's a monthly penalty for the rest of your life. So I've met several people who never signed up for it. They thought it was a one-time penalty. And I'm like, no, that's going to be $5, $10, $15 every month for the rest of your life.
Wow.
Wow.
I feel like that should be what they're talking about on the commercials we see. Just sign up
for that drug plan. And some of those drug plans, you can get really super cheapy ones, or it's in your Advantage plan. So get something so you don't have a late enrollment. But if you are working and you have credible coverage, you don't have to sign up. You can defer it and sign up later.
Okay.
But then if people are on Social Security disability, like if I get disabled now and 2 years later and I'm on Social Security disability for 2 years, I am eligible for Medicare after that. 2 years of being on Social Security disability. So that's something that a lot of people don't realize. I'm like, and then they think when they turn 65, it's a different Medicare. I'm like, nope, it's the same Medicare. You're eligible for Medicare.
Well, that
Right.
I have learned a lot today.
Yes.
So thank you both for.
And if you're in
sharing.
Arizona, call Pauline.
Yeah. Well, and so
Thanks,
Patricia is going to call you, by the way. So just
Yep.
or email
Thank
you
you.
one or the other.
Yep.
So definitely. And I don't know if John has any questions or not, but he was on here too. So Paige, what have we got again? If you remind us what we've got coming up and when again.
So a reminder for our last webinar of the year is going to be November 2nd. It's going to the first Thursday of the month. Enjoying the holidays while caring for your aging loved one. This is going to be a really good one. It talks about, especially if you have someone with dementia. We're going to kind of go through some of the key points of going through the holidays and how we can make it enjoyable for you. So we look forward to having you on the next call, and thank you so much for
What about
attending.
for those people who are in Arizona? Don't you have a more information about important documents seminar coming up?
Oh yes. For
Right.
in Arizona, yes. For those of you in the Valley area in Arizona, we have a Get Your Plan B in Place. And it is a class that a colleague of mine, we work together, Elaine with Visiting Angels and myself will be doing a class. And it's a very in-depth class, about an hour and a half to 2 hours, depending on how many questions. But it is going to be Wednesday, October 11th at 1:30 p.m. And that is located at the park at Copper Creek. And I'll put it in the chat here. And it's in person. We'll have refreshments and we've got plenty of seating. We've got, plenty, and it's a beautiful community to come in and sit in and have some coffee and refreshments and get some really good documents and ask questions. So it's kind of that, get your plan in place just in case, because all things come to an end. And so it's better to be prepared to have all that stuff. So you have someone to be able to guide your wishes for you. So I'll put that information in the chat before we end here. And please, if you have any other questions, chime in.
And if you have a loved one with dementia and just want to chat about your caregiving journey, that's where I fit into this group of individuals. So again, it's a difficult journey. It certainly can be challenging in lots of different ways. Today, we kind of veered off of that, but if you want someone to talk to as part of participating, you get a free 30-minute session with me. So I want to make sure that you have the support that you need on this challenging path that you are on. So feel free to reach out to me at pam@itsnotthatsimple.com.
Perfect. I'm almost done with the chat here.
So
thanks so much for having me.
You're very welcome. Thank you so much for coming, because this is a very confusing topic, and we could probably talk all day long about specific questions. And even that last little statement that you made about the part A, part B, part D, part C, and it's like, okay, so what if I'm in this situation? And so it varies for everyone. And ultimately, that's what we have to keep in mind, is that every single one of you is a snowflake. You are an individual, unique entity. Your needs, your cost tolerances, your risk tolerances are different. So that's why we love you, Pauline. Okay, are you finished, Paige, with your little note here? Okay. Okay, well, thanks everyone. Appreciate you being here. And if you want to catch any more, go back and listen to the recording. That will be coming out on Tuesday. I get lots of questions about this. So we'll be sending you the recording of this so you can review it again at your leisure once I send it out on Tuesday. Okay. All
Thanks,
right.
everybody.
Thanks, guys. Take care.
Bye.
Bye.
Thank you.
Thanks.